Hello, good morning. Hope you can hear my voice clear. This is a recorded session for you to follow for the unit that we are going to discuss today. I'm Dr. Anita Khoso, and I'm a lecturer at the University of Greater Manchester, Bolton, where I teach medicine and I teach public health. And I hope you're okay. This lecture will be, because it is a recorded session. Please do go through it, the recordings, and the resources have also been shared with you on Moodle. However, if you find it hard or there's any questions that you need to raise, please feel free to email us at ukversity.co.uk. It's ukversity. It's learnerwork at ukversity.co.uk. Learnerwork at ukversity.co.uk. I'll be starting this session right now. Since this is a recorded session, I'll be waiting for participants to join. If they don't, uh, it's always free to you're always free to ask questions later on. So this unit, before sharing this unit, the learning outcomes with you, I will take you through the unit itself, what it is about. Um, so just bear with me a minute. There are 4 learning outcomes in this unit, but because we are doing a tutorial session, we will go through them one by one in a very brief manner. Okay, I'm sharing what the unit entails. What is it about? So the unit, which is known as Leading and Managing Health and Social Care, this will this support you in developing key concepts, theories, and models of leadership and management and how they are applied in health and social care. And it will also help you understand how leaders in care can create positive organizational culture. Okay. And learners will explore, you all will explore the regulatory and legislative requirements in health and social care, which is relevant to a specific area of care and national context. So, the level 5 unit, and it's got a pass, merit, and distinction. We will go through the assignment discussion as well once we're done with this. So I'll stop sharing here. There are 4 learning outcomes, as I already said. So I'll be sharing the first learning outcome with you. Just bear with me a minute. Sorry. So this is the first unit. So it's the learning outcomes talks about the understanding uh, of the regulatory environment for health and social care. Okay, I'll make the screen bigger. I hope it's visible to you all. And about this unit, that it will we've talked about what this unit is about. This learning outcome in particular will talk about the theories, models of leadership and management. We'll look at how leaders in care can create a positive organizational culture. We've talked about this. So, when we want to understand the regulatory environment for health and social care, so it is complex as any other organizational structure may be, and it's multifaceted, that it has multiple aspects to it, and they are designed to ensure that the delivery of the services to the public is safe, effective, and high quality. This environment has a range of legislatory and regulatory bodies, professional standards, and they work together to safeguard the interests of the service users and providers alike. I'll go through it very quickly because we have 4 learning outcomes and the assignment discussion to follow to cover as well, and I'm conscious of time. So the legislative framework, we'll talk about it. It provides the legal foundation for the regulation of health and social care services. A key pieces of legislation, which include some very important acts that, excuse me, you need to remember. So when you're working in a healthcare setup, so you have the Health and Social Care Act 2012. This act introduced significant changes to the structure of the NHS, and it aims to give patients greater control over their care. And this enhances the accountability of healthcare providers. The CARE Act 2014, so this legislation sets out local authorities' duties in legislation and assessing people's needs and eligibility for publicly funded care and support, and it emphasizes the importance of promoting well-being. The Mental Health Act 1983, which was amended by the Mental Health Act 2007. So this act governs the treatment and care of people with mental health disorders, and it also provides the legal framework for their assessment, treatment, and rights. These acts, they're very important to know because when you talk about regulations and when talking about dignity and rights of individuals, you need to know about these. Then there's some regulatory bodies that are responsible for the smooth sailing of the NHS and other organizations associated with them. You have the Care Quality Commission, an independent regulator of health and social care in England, monitoring and inspecting and regulating the services to ensure that they meet fundamental standards of quality and safety. You have the NICE guidelines, the National Institute for Health and Care Excellence, and it provides national guidance and advice to improve health and social care. Its guidelines help to ensure that services are based on the best available evidence. Then you have the General Medical Council, the GMC, and Nursing and Midwifery Council, which is the NMC. They're there to regulate medical and nursing professionals, ensuring that they meet the required standards of practice and behavior. Then you have professional standards and codes of practice. You have the GMC's Good Medical Practice that sets the standards for doctors in the UK, outlining the principles and values on which good practice is founded. You have the NMC's Code of Conduct. This provides the framework for nursing and midwifery practices and promotes high quality, high standards of care and professional behavior. Quality assurance and improvement bodies are there, and frameworks are there as well for them. You have the clinical audits. As the name suggests, I'm not going to go into detail. For improvement, patient feedback and complaints mechanism is there. There are ethical considerations which play a key role in regulatory framework. So there's autonomy, so people respecting the rights of individuals to make informed decision about their own care. So you inform them that this is how you will be supported, the care that you will be provided, and then they say yes or no to it. Beneficence means benefit, and non-maleficence is not giving, not exposing to any harm. So ensuring that actions are taken to benefit patients and to avoid causing harm. Justice, promoting fairness and equity when you're providing health. Um, we've talked about this. So um, next is to explain the legislation and statutory requirement underpinning a chosen area of care in a specific national context. So in the UK, the adult care is governed by a comprehensive framework of legislation and statutory requirements that are designed to ensure high standards of care, equality, safety, and protection of service users. Now we'll talk about these key legislations and statutory requirements. So you have the Health and Social Care Act 2008 regulations, which were revised in 2014. It establishes the fundamental standards that care providers must meet, and you have responsibilities of the Care Quality Commission as well involved in it. The Equality Act 2010, which aims to protect individuals from discrimination, harassment, and victimization. The CARE Act 2014, we've talked about it, the Care Quality Commission, which have key lines of inquiry. So the framework used by Care Quality Commission to assess care services across 5 domains. So it's safe, effective, caring, responsive, and well-led. Then you have the safeguard legislation, which protects adults at risk from abuse and neglect. It establishes the duty of care providers to report and act on safeguarding concerns. Health and safety at work legislation, which ensures the safety of both service users and staff within care settings. It requires a risk assessments, training, and adherence to health and safety protocols. Fit and proper person requirements. So this mandates that that the individuals in key positions within care organizations are suitable for their role. So if you're putting someone on this role, or placing them on this role, you need to have DBS checks and etc. Mental health legislation, which was the act was founded in 1983, which governs the treatment of individuals with mental health conditions. Mental Capacity Act 2005, providing the framework for making decisions on behalf of individuals who lack the capacity to do so themselves. Liberty protection safeguards, which ensures that any deprivation of liberty for individuals who lack capacity is lawful and in their best interests. Codes of practice, these set out professional standards of care workers and organizations, for care workers and organizations. And we'll talk about, this is the summary table. We've gone through all of this. This is a good table that you can have a look at. Then we go on to analyze the organizational system and processes to ensure compliance with regulatory requirements. Just a minute, sorry. Yeah. So we'll talk about these. So the quality measures, obviously, as the name suggests, the examples are clinical audits, performance indicators, benchmarking against standards. You have feedback systems, which include surveys. You have suggestion boxes, complaints, procedures. Then you have policy reviews, which include annual reviews, consultations with stakeholders, incorporation of new legislation. And you have audits, which include internal audits, external audits, and compliance checks. Action research. So this includes pilot projects. You have continuous improvement initiatives, collaborative research with academic institutions. Now coming towards the roles and responsibilities and accountability of people. So there's a registered manager. As the name suggests, they oversee the day-to-day operation of care, of the care services. Their responsibilities are several, and they're accountable to the organization's leadership and regulatory bodies. Then there's a nominated individual who acts as the main point of contact between the organization and regulatory bodies. They ensure that the organization meets its statutory obligations, representing the organization during inspection and audits. Then there's accountability, that holds ultimate responsibility for compliance and quality of care. This is a summary table. Now we analyze examples of the response of organizations to inspection requirements. So types of inspection, may be comprehensive. Detailed reviews are taken of the overall performance across all services. There may be focused inspections, which are targeted reviews based on specific concerns only, or areas of performance, so that a patient might have given a feedback about the administrative staff. So they're just focusing on that bit, not on all. And then there's thematic inspection, that reviews focused where the reviews are focused on particular themes or issues across multiple organizations. Then the report outcomes and implications. So ratings are where organizations are rated on outstanding, good, requires improvement, or inadequate, where they can even close down. So there's detailed feedback that is given on strengths and areas that need improvement, and recommendations that suggest actions to address identified issues. Then there's potential enforcement actions, which give you formal notices requiring improvement within a set time frame. There may be fines, such as penalties for non-compliance. Service restrictions may be there, or closure in severe cases. Some service information requirements may include public availability, transparency of reporting, reporting obligations. Local authorities and CQC requirements include CQC inspections, which include inspecting, reporting, and improvement actions. Local authority oversight may have additional requirements and oversight responsibilities for care services within their jurisdiction. Then there are organizational responses demonstrating compliance. You have action plans, you have training and development that goes on for staff, you have quality improvement initiatives such as continuous improvement and feedback integration. So these are some of the references. I'll quickly start sharing my screen for the learning outcome 2. Any questions? As I said earlier, please feel free to email us at learnerwork@ukversity.co.uk. Just give me a minute. Sorry, I'm closing down one so that leads to less confusion. The second learning outcome is based on managing. So it's understanding management and leadership of theories, models, and concepts and their application in health and social care. So we'll talk about this in detail. So there's key management and leadership theories, which you have several of them. So there's the classical management theory, which you have the scientific management, which is known as Taylorism, which focuses on optimizing and standardizing tasks to increase productivity and efficiency. Then you have administrative theory, which is known as FAOL. This emphasizes on the importance of management functions such as planning, organizing, leading, controlling, and their principles such as division of work, authority, discipline. Then you have human relations theory, where you have Elton Mayo and Hawthorne, studies. These highlight the importance of social factors and employee welfare and productivities, and emphasizes the role of communication, teamwork, and leadership in improving worker satisfaction. You have the contingency theory, where you have Fielder's contingency model that suggests that the effectiveness of a leadership style depends on the situation. Leaders must adapt their style to the demands of the environment and task. There's Hersey-Blanchard situational leadership, which proposes that leaders should adjust their style based on the maturity and competence of their followers. I'm not going to go into details. These are there for you to read if you want to and get thorough information in your reading material on Moodle. Then there's transformational and transactional leadership. So transformational leadership burns Bass. So this leaders inspire and motivate others to achieve higher levels of performance by fostering a shared vision, encouraging innovation, and supporting individual development. Then there's transactional leadership which focuses on the exchange process between leaders and followers, using rewards and punishments to achieve compliance and performance. You have systems theories, which views the organization as a complex set of interrelated parts working together to achieve common goals. This emphasizes the importance of understanding and managing the relationships and interactions within the system. Then there's complexity theory, which recognizes that health and social care organizations operate in complex dynamic environments. Leaders must be flexible, adaptive, and able to manage change and uncertainty. Applications of these theories, how to apply them in health and social care. So these are there for like improving quality of care. You use the transformational theory by inspiring and motivating staff. Transformational leaders can create a culture of continuous improvement and health and high quality care. You have a clear vision, you encourage innovation and recognize the contributions of all team members. Then there's systems theory. How do you use that? Applying systems thinking helps to identify and address all the systematic issues that impact the quality of care. Then there's enhancing staff motivation and engagement. So you have the human relations theory, which emphasizes the importance of employee welfare and social interactions. That leads to higher job satisfaction and motivation. You have team building activities. You have regular meetings, as effective communication during those meetings. Then there's situational leadership. By adapting leadership styles to the needs of individual staff members, leaders can provide the appropriate level of support and direction, enhancing engagement and performance. Managing care and innovation. So there's complexity theory. So leaders in health and social care must be adept at managing care in a complex environment, and this involves being flexible, encouraging innovative solutions, and supporting staff through transitions. Contingency theory. So this recognizes that there is no one size fits all approach to leadership, and this theory supports the needs for leaders the need for leaders to be adaptable and responsive to the specific needs of their organization and situation. Ensuring operational efficiency. So there's scientific management, there's where you have standardization tasks and optimizing workflows, which can improve efficiency and reduced waste. However, this is very important to understand that there should be a balance with this, with a focus on employee well-being and job satisfaction. Then you have administrative theory, which applies principles of management functions, which can help ensure that health and social care organizations are well organized, they're efficient, and they work towards their goals. Now we are analyzing the theories and models of leadership and management. How do they work together as a whole? So leadership theories and models, there's the trait theory, which is described as suggesting that certain inherent traits make the person an effective leader. So these traits include confidence, intelligence, determination, integrity, and sociability. So they're social enough. Leadership or management styles. So there's one which is authoritative, as the name suggests. There's democratic that has participatory decision making and it encourages input. Laissez-faire, with there's minimal supervision and there's high autonomy for staff there. There's multiple intelligence or Gardner, which is described as where the purpose is it proposes different types of intelligence, such as linguistic, logical, mathematical, interpersonal, that can influence leadership effectiveness. Then there's transactional leadership, which focuses on exchange between the leader and the followers, using rewards and punishment to achieve compliance. Then the key concept is that there's contingent reward management by exception. Transformational leadership, it inspires and motivates followers to achieve higher levels of performance and foster significant change. And the key concept is idealized influence, inspirational motivation, intellectual stimulation, and individualized consideration. Action-centered leadership, ADARE, so it balances the need of the task, the team, and the individual. The key concept includes task needs, how can the team be maintained, and individual needs. The situational leadership, Hersey Blancard, where leadership styles are adjusted according to the situation. So this includes telling, selling, participatory, or delegating. Maslow's hierarchy of needs. So here, leaders can motivate by addressing these varying needs, and this suggests that individuals are motivated by a hierarchy of needs, from basic psychological needs to self-actualization. You have McGregor's theory X and theory Y. So X assumes people dislike work and need control, while Y theory assumes people are self-motivated and seek accountability. So these are some management theories and models. So you have the contingency theory, the behavioral theory. Then you have management by objectives, which involves setting specific measurable objectives with employees and then periodically reviewing progress. The key concept is goal setting, participative decision making, and performance reviews. These are some of the comparisons of leadership and management. So a leader inspires, their focus is to inspire and guide people, while a manager plans, organizes, and coordinates resources. The leader has a visionary approach and motivational, whereas a manager is structured and procedural. The primary role of the leader is to as a change agent, as an innovator, whereas a manager is administrative and a stabilizer. The skill set that a leader has to have is emotional intelligence and communication, whereas a manager needs to have analytical thinking and operational efficiency. The key theories or models that work with leadership are trait theory, transformational theory, and situational leadership, whereas in management, you have the contingency theory, the behavioral theory, management by objectives, MBO. The outcome for a manager are long-term vision, structural change for a leader. Are long-term vision and structural change. For a manager, they are short-term goals and operational successes. This is all a summary of a table of theories and models. Now we want to assess the application of theories in the chosen area of health and social care. So in a care home setting, for instance, effective leadership and management are essential for ensuring that the quality of care is high, staff satisfaction is high, and there's operational efficiency. When you apply various leadership and management theories and models, the care home managers can address the unique challenges and opportunities within this environment. This assessment examines how these theories and models can be practically applied in a care home setting. Now, so in a application for leadership theories, how do you apply them in a care setting? So transformational leadership. So care home managers can use transformational leadership to inspire and motivate staff by creating a shared vision of high quality care and continuous improvement. Here is an example. And then situational leadership, where the manager can adapt to their leadership style based on the competence and commitment of their staff members. Such as a new care worker might need a more directive style initially, where they've been told, while experienced staff may benefit by just delegation. Action-centered leadership. So, for instance, a manager ensures that care plans are followed, the tasks are followed, they give them tasks, they are followed, promotes team cohesion through regular team meetings, and provides personalized support and development opportunities for staff. This is individuals where they're involved in it. Transactional leadership. So there's rewards and punishments there. And for instance, implementing a reward system where staff members receive bonuses for excellent care outcomes or adherence to protocols, and addressing underperformance with additional training or corrective actions. Maslow's hierarchy of needs. So managers can use this theory to understand and address the various needs of their staff to enhance motivation and job satisfaction. So this ensures that basic needs like fair wages, safe working conditions are met before addressing higher levels of need like recognition, opportunity for professional growth, etc. You have McGregor's theory X and Y, adapting management style based on assumptions about staff motivation can help effectively leading the team. So assuming that theory Y is motivated and responsible for most staff can lead to a more participatory and empowering management style which fosters a positive work environment. Application of management theories and models. So you have the contingency theory. You have there where managers can tailor their management strategies to specific contexts and care of the care home. Such as during a flu outbreak, the manager might adopt a more centralized decision making approach to quickly implement infection control measures. You have the behavioral theory, which focuses on managerial behaviors that promote a positive work environment and high performance. So there's participative approach, encouraging staff to provide input on decision-making processes, and these can lead to higher job satisfaction and better care outcomes. You have management by objectives, MBO. So this sets clearly measurable objectives with staff members and regularly reviews progress to ensure alignment with the care home goals. So example includes establishing specific care quality targets, such as reducing the incidence of pressure sores or ulcers, and they involve staff in developing strategies to achieve these targets. This is a summary. Now we want to evaluate the leadership and management theory. How do we do that? So transformational theory, it impacts on the effectiveness, and it creates a positive organizational culture, and that values continuous improvement and encourages staff development and professional growth. Relevance to health and social care. So this is particularly for transformational leadership. So it's highly relevant as it aligns with the goals of improving patient care and fostering a supportive work environment. There may be conflicts that may be there. Balancing transformational theory with the needs of operational efficiency can be challenging. Then there's situational leadership, where the leadership changes according to the situation. It contributes to effectiveness by including flexibility. It impacts by managing diverse teams. Changing styles may be helpful. Reducing staff turnover by providing appropriate levels of direction and support. Its relevance to health and social care include that they have a diverse set of skills and experience of healthcare workers. This ensures that leadership is responsive to the dynamic and often unpredictable nature of care environments. Then you may have potential conflicts, where it requires leaders to be highly skilled in assessing and adapting to individual needs and may not always be feasible. Transactional leadership, so how it contributes to effectiveness by providing clear structure and expectations through rewards and punishments. It can improve short-term performance and adherence to procedures. It is relevant for maintaining high standards of care and ensuring safety and compliance, and it helps in managing routine operations and maintaining order. And it may also be prone to potential conflicts, like it may lead to a lack of motivation and innovation if overemphasized. And then you have the action-centered leadership, which balances the needs of the task, team, and individual, ensuring that a holistic approach is achieved. It promotes teamwork and individual development, and it encourages the balanced focus on all aspects of leadership and enhances team cohesion and effectiveness. It is highly relevant as it addresses the complex interplay between different needs in a care setting, and it supports comprehensive management of care services, ensuring that all aspects are considered. It may require a high level of skill to balance all three areas effectively. Maslow's hierarchy of needs. So here, it provides a framework for understanding staff motivation and addressing their needs, leading to job satisfaction and motivation by fulfilling various needs of the staff. This can reduce turnover. So it's highly relevant as it helps in creating a supportive and fulfilling work environment. You're more fulfilled when you get what you want with what you've been working for. There may be conflicts with purely task-oriented approaches that overlook individual needs. Contingency theory. So it emphasizes the importance of context in determining the best management approach and encourages flexibility and accountability in managing practices. It improves the responsiveness and effectiveness in varying situations, helps alignment of management strategies with environmental demands. It's very relevant because of the diverse and dynamic nature of healthcare settings, and it supports the need for adaptable and context-specific management approaches. It may be difficult to identify the right contingency factors and implement appropriate strategies consistently. This is a summary table of the evaluation. These are some of the references. I hope that is clear. I'll stop sharing this. I'll start sharing the third slide, the third learning outcomes. Close down the second learning outcomes. I hope that is clear. If there's anything that needs more clarification, please feel free to ask, as mentioned earlier. Now, the third learning outcome is, sorry. Third learning outcome is to understand effective team leadership in health and social care. Quickly, I will skim through this again for your understanding. So there are key concepts that we need to understand. There's team dynamics, there's communication, there's collaboration, there's conflict resolution, there's goal setting, there's delegation. I'm not going to go into details because these are very self-explanatory. There's motivation. So leadership theories and models apply to team leaderships. We've talked about this. There's transformational leadership. It leads to higher levels of team engagement, satisfaction, and performance. Situational leadership enhances team development and effectiveness by meeting the team where they are. Action-centered leadership, it promotes a holistic approach to leadership that addresses all aspects of team functioning. Belbin's team roles. So there's it identifies 9 key roles that individuals play within a team. So you will have a coordinator and an implementer, the plant, and it uses this understanding to build balanced teams. It helps in creating well-rounded teams with each member's strengths and where they're utilized effectively. Tuckman's stages of team development. So this recognizes the stages of forming, storming, norming, performing, and adjourning, and provides appropriate support at each stage. So this facilitates smoother transitions through the stages, improving team cohesion and performance. Then there are practical strategies for effective team leadership. So you have the regular team meetings, conducting the regular team meetings, team building activities. We've mentioned these before. Performance reviews and feedback. There's professional development, inclusive leadership. Now we go on to evaluate the theories of team leadership, team development, and working, and their application in the chosen context. So features for effective team member performance they select team members with complementary skills and a commitment to the team's goals. There's clear processes, there's agreed objectives, there's appropriateness of team members. So wherever they are there, they have the necessary skills and knowledge and attitudes. There's creativity, there's problem solving, there's decision making efficiency. Theories of team working. So there's Tuckman's team formation model, which helps managers understand the stages of team development and provides strategies for supporting teams through each stage. There's Belbin's team role theory, which identifies the strengths and weaknesses of team members. We've talked about this. There's the Myers-Briggs type indicator, MBTI theory, which helps understand personality types within the team, fostering better communication and collaboration. There's the GRIP model where there's goals, roles, interpersonal relationships, and processes. This provides a framework for assessing and improving team performance by focusing on key elements of effective teamwork. Tuckman's team formation model, it is very effective, provides a clear framework for understanding team dynamics. Where managers in a care home can use this model to support staff through stages of team development, enhancing cohesion and performance. So for instance, during storming stage, managers can facilitate conflict resolution and establish clear roles. Belbin's team role theory. So it is effective in creating balanced teams with complementary roles, enhancing overall team performance. This identifies the strengths and roles of each team player, care home manager. The care home managers can allocate tasks more effectively. For instance, a plant can generate innovative ideas for improving resident care, while an implementer can ensure these ideas are executed effectively. Myers-Briggs type indicator. So this enhances understanding of personality differences, improving communication and teamwork. Sorry. And for instance, when you know the staff are more introverted, so it's personality type, okay? So this can help in designing quiet workspaces or providing more written communication for them. The GRIP model, this helps by improving goals, responsibilities, and interpersonal relationships and processes, where managers can ensure that teams work more effectively and efficiently. Like if you clarify the roles and responsibilities, this can prevent overlap and conflicts while improving processes and can enhance the quality of care provided. This is a summary table. Now we assess the potential barriers to teamwork in health and social care setup and how they can be addressed. So the personal barriers, you have value differences. Team members have different personal values that can impact their work priorities and interactions. Attitudes may be different. Behavioral differences may be there. Then there's organizational barriers where there are unclear goals. There's lack of time or resources. There's shift working. How do you address them? So conflict resolution strategies may be there through mediation, active listening, compromise, and collaboration. You may have smart goals for goal setting. Regular reviews can be there, or regular meetings. Better planning can be done. So resource allocation, scheduling, and team meetings. Training and development can help in team building activities, can be helped through team building activities, their communication skills training, or cultural competency training. This is a summary of them. I'm not going to go into details of this. Now we'll go into reviewing the different types of teams within chosen context. So in a care home, various types of teams work together. Each type supports the other. So there's operational teams. The purpose is to manage the day-to-day operations. There's nursing staff, their care assistants, housekeepers, administrative staff. They're essential for maintaining routine care and ensuring that daily activities run smoothly and efficiently. Multidisciplinary teams, which provide comprehensive care, as the name suggests, there are multiple people involved in it. Interdisciplinary teams, similar to MDTs, multidisciplinary teams, but there's stronger emphasis on integrated care planning and delivery, such as coordinated care planning meetings involving various healthcare professionals who work closely together on care strategies. They're suitable for creating highly coordinated care plans that require seamless integration of services. There's working parties. So the purpose is to address specific issues or projects within the care for a care home. There's development groups. Benefits of team working include sharing knowledge and expertise, coordination and collaboration, integration of care, continuity of care. Team relationships and their importance has to be acknowledged. So there's trust and respect, there's clear communication, mutual support, shared goals. These are some of the references. I'll quickly go through the last learning outcome and then we will proceed towards our assignment discussion. So the last learning outcome is yeah. So this is about understanding how to lead and manage a health and social care service. I'll quickly go through it. I'm not going to go into too many details. They're very self-explanatory. And then we'll go through the so key areas for leadership and management, they're strategic planning and vision, where you develop a long-term vision and a strategic plan for the service, such as a care home manager creating a 5-year plan to improve care quality, expanding services, and enhancing staff training. Operational management, which oversees the day-to-day operations to see that they're working smoothly. Quality assurance and improvement, so there's continuously monitoring and improving the quality provided. There's regulatory compliance, such as care quality commissions. There's financial management. There's human resource management. There's key stakeholder. So all those stakeholders, that is, they're engaged, which includes holding regular meetings with residents' families to discuss their concerns and suggestions. There's change management, such as introducing new technology to improve care delivery and training staff to use it effectively. So you have detailed discussions on this. I'm not going to go into these details. We've already talked about them. So now we explain the features of effective business and resource management. How can you do that? There's accurate forecasting, technological integration, sustainable practices, and robust management of daily operations. Resources. These resources are used on a regular basis. There's accurate forecasting. Hello, I can see someone join. Dora. I'm sorry, Dora. Since when did you join? Good morning.
Good morning.
Since the session.
I just joined, please.
Okay. Before these slides, there's all the recordings are available. I was just mentioning. So I have made this recording just for you guys that whenever you want to see. If you have any questions, please feel free to ask. Okay. You can ask them now or then because you've not seen the recording, so you can see the recordings and always ask any question. But the very simple slides which I've gone through.
Okay, thank you.
No problem. If you don't mind, I'll just quickly take a snapshot of your that you're here. So I'll just quickly take your this is for attendance purpose. Thank you for joining. It feels more human to teach someone instead of just speaking to myself. Yeah. But yeah, I had to do the recording because Yeah, that's it. Okay, so I will resume my slides. You're doing the fourth learning outcome. We have discussed 3 learning outcomes so far. And recordings will be available to you, as I said earlier. Now, so there's key features of effective business and resource management where you have resource use, where you have accurate forecasting. So you know of what happens, what are the data trends. You ensure sufficient resources are there available to meet the high rising demands. For instance, historical patient admission data can be used to forecast staffing needs during peak times, such as COVID-19. You can use technological tools in planning, such as electronic health records, which are there to track patient needs and ensure that there's adequate staffing and equipment availability. Sustainability, so whatever you're doing, it needs to be sustainable, such as reducing waste, conserving energy, and using eco-friendly products. Business continuity, so here you creating a detailed planning for continuing care during a natural disaster, for instance, or major IT failure. This is how you continue your business work. Management of operations, so how do you do this? So this is through staffing. So there's regular staffing, there's scheduling software to manage shift rotations and avoid understaffing at all times. There's administration where administrative um, focus, where you use an integrated administrative software system to manage resident records, billing, and compliance documents. There's good housekeeping, where you use digital checklist for housekeeping staff to ensure all areas are clean and maintained regularly. Communications, this is self-explanatory. Contingency planning is preparing for unexpected events that could disrupt operations. So you create a backup staffing plan for when regular staff are unavailable due to illness or any other emergencies. This is a summary table of all what we've talked about. Then I'm not going to go into detailed discussions. We've talked about this already. Now I'm going on to explain the process and consideration. Sorry, I need to do this. In making effective decisions. How do we make decisions and how do we make sure that they are effective enough for running the day-to-day activities of such as a care home? You have to have so there are types of decisions such as strategic decisions. They are long-term decisions that shape the direction and policies of the organization. Examples are deciding to expand services, merging with other organizations, or implementing new care models. They're tactical decisions where these are medium-term decisions so they're not long-term, they're medium-term to a set time, where you're planning staffing levels for a new service, budgeting for next fiscal year, for instance. Operational decisions are short-term, day-to-day decisions. Staffing, scheduling staff shifts, responding to an immediate patient care issue, for instance. Use of data and information is very important. So here there's evidence-based decisions that you can make through clinical guidelines, research studies, performance data to guide decision making. There's use of research, which I've just mentioned, data and analytics. So you use patient outcome data, which the registers are there, and you have that electronically as well, or the financial data to budget effectively. Influence of ethics, values, and attitudes. We've talked about ethics a little before. Ethics are moral principles that guide decision making to ensure that there's fairness, justice, and respect for individuals. You have confidentiality, you have informed consent, and equitable access to care. The values are core beliefs that influence priorities and actions. Attitudes are very important. So these are personal perspectives that affect decision making. This foster a positive attitude towards change, encouraging openness to new ideas, and promote a supportive work environment. What is the process of decision making? You identify which decisions are important. You use research, so you gather and analyze what is there already. You identify possible solutions and options. You evaluate those solutions. Then you involve the right people in this decision making, and then at the end you make decisions. Then you implement these decisions and you evaluate at the end the decision and the process. Okay. I'm not going to go into these detailed discussions. Now, we analyze the features of positive value-based culture and how this impacts the management of a health and social care service. These are the last bits of slides. Then we'll go to our assignment discussion. So, a positive value based culture in health and social care is fundamental. We know that it needs to be value based. Culture where it's person centered, where you're focusing on that person who you're providing care for. It improves patient satisfaction and outcomes by making care more relevant and effective. There's mutual respect, there's dignity for everyone where you're working. There's trust, there's confidentiality, which is maintained, there's privacy, and there's empowerment for the patient themselves. There's safeguarding and there's inclusion. This is a summary table. What is the impact on management through all of this process? There's enhanced quality of care, improved staff morale and retention, increased trust and engagement, compliance with regulations, and sustainable practices. Now we go on to address the assess strategies to balance profit-based approaches with a positive value-based culture in a chosen setup. So balancing profit-based approaches with a positive values-based culture in a care home involves integrating ethical principles and business strategies to ensure that both financial sustainability is there and high-quality care is also there. This balance is very important. So here you establish um, shared vision and objectives. This is to create by creating a unified vision and set of objectives that align the financial goals with values-based care principles. It ensures that all stakeholders are working towards a common goal. Setting priorities is very important. It aligns resource allocation with dual goals of profit and value-based care. Monitoring and continuous improvement is self-explanatory. Modeling and sharing best practice. So you model, and this encourages you identify and promote best practices that exemplify both quality care, high quality care, and efficient operations. So you would share successful strategies and practices across the organization through training and workshops. Identifying personal skills, values, and attitudes, establishing trust and accountability, implementing strategies like identifying behavior and organizational process changes that are required, setting aims and objectives, communicating vision and the mission, adapting in response to evaluation and feedback, adapting leadership style. This is the summary. Not going to go. So last is to identify personal skills, values, and attitudes. So it's very important when you're developing right skills in staffs which support a positive culture and high performance. This is to provide training and development opportunities that focus on both the ethical care and financial management. You establish trust and accountability. You implement strategies. This is very important, where you're understanding what needs to change and what is important, what doesn't, what is not important. You set up aims and objectives which are very clear. You have SMART objectives. Which are specific for one time period, measurable, they're achievable, they're relevant, and they're time bound. Okay. These are goals that integrate both care and financial priorities. You have proper communicating and vision. You have communicating vision and mission through different meetings. You have through newsletters, training sessions. Sorry, you adapt in response to evaluation and feedback. So whatever feedback you get for the organization, you adapt according to it. You adapt to the leadership styles. You are flexible in that. So this is the conclusion. These are some of the references. I'll stop sharing here and I'll quickly go through the assessment discussion now. I know this is a tutorial session, that is why we've had to rush through it, but you can always go through the slides and get all the information there. They're very self-explanatory. I'll quickly go through the slides now for our assessment discussion. So assignment discussion, because we've started our assignment discussion today, it gives you 2 weeks to complete your assignment. Okay. So this is, I'll share the date with you. So now we started. So your first assignment scenario is that you work with a senior management team of an organization which is involved in health or social care. You have been asked to advise as the senior management team on issues that are related to leadership and management in the organization. You should select a suitable area of health or social care on which to base your work within a chosen national context. You should be able to provide a short summary of your chosen area at the start of your assignment. Now, that's the scenario. So your first task is to identify key legislation that affects your chosen area of health or social care. You can choose any area of health or social care, and you develop a PowerPoint presentation, just like this presentation, for delivery to the senior management team. And you're talking about, in that PowerPoint presentation, you're talking about the legal requirements and the systems and processes that will ensure compliance. You should be able to produce slides and detailed notes for the presentation. For your slides, please make sure that you explain the key legislation and statutory requirements underpinning your chosen area of care in your national context. So you may be from Nigeria, you may be from any other country of the world, and you want to work on that in that setting, or you want to work in the UK setting. It's up to you. What you have to do is you have to identify the key legislation and statutory requirements that are underpinning. So you may want to work in a care home, talk about a care home. You analyze the organizational systems and processes that will ensure compliance within the regulatory requirement. So uh, you can have a pass, so you'll be working on these objectives. However, if you want to have a merit, your slides should also include where you analyze two examples of the responses of organizations to inspect requirements relevant into your chosen context. So the learning outcomes that you would want to review are all the learning outcomes one. Related to the first learning outcome, first slides, first presentation slides. Your second task is that members of, I hope that's clear, the members of the senior management team know that you have been studying leadership and management theory and team membership leadership, and they are interested in knowing about this and how it may improve the leadership and management of the organization. They have asked you to write a report for the team to consider. You should use examples from your chosen context in your report. It may be a care setting, a hospital setting, whatever you want. Here, your report must include. Now, this is a report, so it's not a PowerPoint presentation, it's a Word document. You analyze 3 theories or models of leadership and management that are relevant to your chosen context. You assess the application of your selected theories or models in your chosen area of health and social care. You evaluate Tuckman's theory of team formation and Belbin's team role theory and their application in your chosen context. You would want to assess the potential barriers to teamwork in your chosen context and assess how these can be addressed. Now, if you want to gain a merit, you would also want to review the different types of teams used within your chosen context and their purposes. So you can talk about different teams. That's the management
Anita.
teams. Yeah,
Yeah, my break is over, so if I can go now, love. Thank you.
that's fine. You can have a look at the recordings. No
Okay.
problem. Thank you. So in order to achieve a distinction, you would want to evaluate the 3 selected theories and models of leadership and management. So the learning outcomes that you would want to look at are learning outcome 2 and learning outcome 3. Now, task 3, so the last task, yes. So the senior management team now wishes to improve leadership and management within the organization. You are asked to write a guide, again, a Word document for the guide about how to lead and management a health and social care service. This guide should include the explanation where the features of effective business and resource management in your chosen context, explaining the process and considerations in making effective decisions in your chosen context, and to analyze the features of a positive value-based culture and how this impacts the management of a health and social care service in your chosen context. If you want to have a distinction grade, you would also want to assess strategies to balance profit-based approaches with a positive value-based culture in your chosen context. Learning outcome 4 is there for you. That's the end of the slides. If there are any questions, I'm free to take them. Please email at ukversity.co.uk. So we've had our discussion for the assignment on the 24th of January. So this gives you 2 weeks, which is the 7th of November, 7th of February for your assignment submission. 7th of February is the deadline for the assignment discussion. Thank you so much. I'm now going to end the presentation and good luck to you. The slides and the recordings will be available to you on Moodle. Thank you. All the best. Take care. Bye.